Hi, I'm Dr. Gadusi, one of the family physicians here at Beale. One of the issues that we've been having is an issue with access, and I thought one of the ways to alleviate that would be to prevent patients from coming in for things that could be treated at home. Over time, you begin to recognize more and more that there are certain algorithms that you could go through for patient care, whether it's a viral upper respiratory infection, gastroenteritis, and typically all of these things can actually end up being cared for at home. The problem is if you end up caring for them within the clinical setting, it ends up taking up more and more acutes, and that ends up being a problem.
Somebody passed out up front.
Ooh, I'm out of acute appointments for today, but we could book one for tomorrow. And with that, we end up having an issue with access. So you may be asking yourself, how does this work? Well, I'll answer that easy. There's a kiosk up front, and you decide, hey, you know what? I do have an upper respiratory infection. No, I have not had a fever of over 100.4, and no, I haven't been sick for that long. Once you get to the final screen, you end up getting a diagnosis. In this case, is usually a viral upper respiratory infection. You get notified that you can have up to 24-hour quarters just talking to your unit commander, and we can actually include with our sick program here at Beale recommendations of things that a patient can pick up at the pharmacy. Why does that matter? I'll tell you why. Over this last week, we've had 13 encounters where this would have played a role and prevented a patient encounter with a physician. Extrapolating that out relatively conservatively, that ends up being about 840 visits a year. That's taking into account increased in the winter months. Looking at total RVUs and end up with the reimbursement here in California, here at Beale, not doing these encounters would have saved us $69,787. Extrapolating that to the entire DoD with the 451 other military treatment facilities, that ends up being over $30 million saved in patient encounters that were done unnecessarily. Now, what about readiness? This, of course, ends up being about 840 fewer sick days because typically patients get 24 hours sick call from the time they see a physician. And if they were to go directly to the unit commander, they would get 24 hours from that moment. So drastically reduce sick days both with here at Beale and throughout the DoD in the number of hundreds of thousands total.